Welcome back. You may not know this, but this past Monday was Pharmacy Day, and it's a day to raise awareness about how important our pharmacists are in this province. Joining us today, Julie Ford. She works at Glover's Medicine Centre, where I actually go to get my prescriptions filled much of the time. So Julie, it's lovely to have you here.
It's nice to see you again.
Thank you. Now, to start off, you were in Victoria for Pharmacy Day on Monday.
Yeah, so about 25 pharmacists, including students from UBC, went to Victoria for a day at the legislature, and we set up a mock pharmacy, quite an interactive room with a dispensary where we give out medications, an opportunity for some of the MLAs and other legislative staff to actually get vaccines. So there was quite a few that had pre-ordered their vaccines, and we had pharmacists on hand to administer them. And just an opportunity for us to make them more aware about what a pharmacist can actually do for you.
Didn't Todd Stone introduce you in the house?
He did.
That's nice.
That was quite an honor, actually.
Very cool. So the message you're trying to get out is look at all the things we can do.
Besides our normal dispensing. So there's
right.
a number of things we can do, especially in the last few years. Our scope of practice has expanded quite a bit. So we can now prescribe and give immunizations, as you know. We conduct medication reviews for patients who are on 5 or more prescriptions. So we actually sit down with the patient in a private setting and go over all of their medications with them. It's an opportunity for them to ask questions in a private setting, and a lot more information comes out in that type of environment. We have a couple of proposals on the table to increase our scope of practice. So one of those is allowing us to prescribe what we call minor ailments. So things like hydrocortisone cream, 1%, for example, needs a prescription still. Basically, the concept behind that is pharmacists are well educated to make good decisions about prescribing these products that we've listed. And it would help take the burden off of the family physician. So if a patient comes into the pharmacy, instead of sending them back to their doctor to get the prescription, there's some products that we could prescribe and take responsibility for.
Absolutely, and that was my next question. We are so, our physicians are so downloaded with so many patients, and if there's some way that you guys can ease some of that time of waiting and not having to go to the doctor and then come back with your...
Right. Especially in Kamloops, where it's hard to find a doctor.
Exactly, exactly. And I thought that I would have to go and make a special appointment. I had my children immunized for some vaccinations, and it turns out I didn't even know pharmacists offered that. I didn't know
So
that.
it's relatively new. It started in 2009 when the H1N1 issue arose, and basically there wasn't enough people to administer vaccines. So people started looking at who else in the healthcare system could provide an easy access for patients. So pharmacists started giving flu vaccines. We started out, I think, in 2009 with giving 30,000 flu vaccines. This past year we gave 360,000.
What a huge jump.
Yeah, so and just last year we were able to start giving non-flu vaccines, so immunizations for your kids or adults that are traveling somewhere and they need certain immunizations. So as long as the patient meets the criteria that the Centre for Disease Control puts out, we can give those vaccines without a prescription.
Fantastic. I think it's good to lend awareness to this. I think a lot of people don't realize you can go to a pharmacy counter, ask a few questions. The worst you guys are going to say is, you know what, we're not allowed to answer that or whatever.
Exactly.
But there's many things you guys do answer.
Yeah,
so.
And I think pharmacists are quite good at knowing their limitations too.
Yes.
We get challenged on that a lot. Whether we would, you know, like how do you know whether you're capable of making that decision or not? Pharmacists are fairly careful people, and they're well educated on drugs and other disease states as well. And we know our limitations in terms of when we're not able to make that decision and refer to the physician.
Fantastic. We're out of time already.
Wow.
Yeah, I know, fast,
quick.
right?
Yeah, it goes by quickly.
I know.
Well,
Thanks for being
having
here.
me.
You're so welcome, and it's nice to lend some exposure to this, because I think it's important for people to realize this, that we love our physicians, but we should also be loving our pharmacists just as much, right? Information is on the screen, bcpharmacy.ca as well. If you would like to learn more, Glover's Medical Centre, that information on the screen as well. Julie with a host of other people there, very friendly folks. I can speak from that firsthand, so thanks again.
Susan.
We're back in 90 seconds. Stay with us.